All right, atropine, common trade name. Well, it's atropine, not much to it. It's just a generic on most of the time. The class, it is an anticholinergic, and it is also a parasympatholytic. So review in your book if you need to know about that stuff. My way of thinking about it is it takes, well, we'll cover that in a second. Mechanism of action: inhibits the acetylcholine at the parasympathetic nerve sites, which causes an increase in heart rate. So in the vagus nerve especially that we look at, it's kind of its way, it's a parasympatholytic, so it takes the foot off the brakes and lets the heart rate kind of accelerate and run away, if you will. The sympathetic and the parasympathetic nervous systems are always counteracting each other, and the sympathetic is trying to go faster, the parasympathetic is trying to slow everything down, and atropine kind of takes the foot off the brakes of that and blunts the effects of the parasympathetic nervous system, so it lets the heart rate speed up. If that makes sense to you. Hopefully that didn't confuse you at all. But causes the heart rate to speed up. Pregnancy class for it is C. Indications is a symptomatic bradycardia, organophosphate poisoning or nerve agent exposure, again looking for that bradycardia, and then you can follow sludge or dumbbells mnemonic for that you were watching out for. Pre-medication with RSI in pediatrics, it blunts the vagal nerve stimulation like we mentioned, and so that way with the kids we don't drop their heart rate whenever we're intubating them. It kind of helps raise it up. And then beta blocker or calcium channel blocker overdose where they've gotten too much medication and causing that low heart rate. This can help counteract that. May or may not work, but it is an indication. Some contraindications: narrow angle glaucoma. It seems like it's a contraindication on every medication practically. And then hypothermic bradycardia. We want to fix the hypothermia. We're more worried about that and solving the issues related to that. Adverse reactions, of course, tachycardia, palpitations, headache, all those effects of having, higher heart rate. Could have some nausea, vomiting, some dry mouth, dilated pupils. And then if you push atropine too slowly and or give too low of a dose of it, i.e. greater or less than 0.1 milligrams, it can cause paradoxical bradycardia and make that heart rate slower. So we want to make sure we're not, pushing it super, super slow, as in over, half a milligram over 10 minutes. And we don't want to give less than 0.1 milligrams. So some drug interactions to watch for. Has adverse effects if given with digitalis, cholinergics, and physostigmine, and it is potentiated by antihistamines, procainamide, quinidine, antipsychotics, benzos, and antidepressants. So that can make the effects of it even more profound. Adult dosing, standard adult dosing anyway, is 0.5 milligrams IV or IO every 3 to 5 minutes, and 3 milligrams is usually your total max dose. With the kids, dosing 0.02 milligrams per kilogram up to half a milligram is your max single dose. And remember, it's 0.02 milligrams per kilogram, and make sure you don't give any less than 0.1 milligrams so you don't get that paradoxical bradycardia. And then if you're dealing with nerve agents, organophosphates, and medication overdoses, stuff like that, then you may require higher doses. You might have to give, a milligram every 3 minutes and not so much worry about the max dose. And you need to follow your local protocols, of course. Duration effects: onset's pretty much immediate. Peak effects in 2 to 4 minutes, and then it can last in your body up to 4 to 6 hours. But the peak effects is pretty quick. Some special considerations: it may be ineffective in heart transplants. So the way it works with the parasympathetic nervous system, those people that have been heart transplant patients and or have infranodal AV blocks, it might not work with those. So we talk about those second and third degree, those high degree blocks, it might not work with them, although it's something to try at least. So it just might not get our desired effects.